Hello, my name is Ara Keshishian and I'd like to talk about vena cava filters. Vena cava filters are types of umbrellas that are placed in certain patients who have had deep vein thrombosis, otherwise known as DVTs, and are at risk or have developed pulmonary embolisms. Pulmonary embolisms are blood clots that are formed mostly and usually in the lower extremities, and they're traveling to the lungs, resulting in obstruction of the blood flow, and the patient may have symptoms of cough, shortness of breath, and some radiologic findings that may be present on a chest X-ray or a CT scan. Blood clots are common in both upper and lower extremities. In upper extremities, we usually see these in patients who've had long-term IV accesses with central lines or PICC lines for either nutritional support or IV antibiotic. And even though there may be common forming blood clots in deep veins, they're usually not the cause of pulmonary embolism, which is when a blood clot travels to the lungs. Most common cause of or location of blood clots that travels to the lungs is lower extremities, and because of anatomical variations between left and right lower extremity, it is a little more frequent in left lower extremities than right lower extremities. There are a number of risk factors that we'll talk on the next slide that renders a patient to be high risk for deep vein thrombosis in general surgical patients. Interestingly enough, one of those risks is obesity, and that's what's a risk factor more frequent in our patients. There are also certain things that may increase the risk of deep vein thrombosis to become embolic, meaning it travels to the lung, and this may be more function of where exactly is the blood clot formed, whether it's below the level of the knee or above the level of the knee. And it is worth it to mention that most of these have to do with deep vein. That's the deep veins, not the superficial veins where a patient may say or be concerned about if they have varicose veins. Now, varicose veins themselves may not be a source of deep vein. However, varicose veins may be a sign of incompetent veins, which connects the deep and the superficial veins, and that may indirectly be a sign that there may be more problems brewing in the deep systems. Risk factors for deep vein thrombosis in not necessarily in a particular order, but what it relates to our lecture is obesity, inactivity, either before surgery or immediately after surgery, previous history of deep vein thrombosis, history of cancer or presence of a cancer, and this is one of those interesting things that a patient that presents with um, deep vein thrombosis anywhere in the body that presents itself with pulmonary embolism and no other risk factor is present, one always has to think about a malignancy. Major orthopedic or joint surgery such as knee or hip replacement surgery, smoking, particularly any type of tobacco use, increases the risk of deep vein thrombosis. There are some specific pre-existing enzyme deficiencies such as protein C, protein S, and antithrombin 3 deficiencies, all of which make a patient to be more coagulable and renders them to form blood clot easier. Pregnancy, mostly because of anatomical compression of the vena cava, increases the risk of blood clot formation. Advanced age, and last but not least, certain medications, including birth control pills and certain hormone replacements, can all increase the risk of blood clot formation. The treatment option is rarely thrombolysis, which is sort of clot dissolving medications, anticoagulations orally or injectable, and in some rare cases, vena cava filter is recommended. Over the years, there has been significant advancement over the vena cava filters based on how they're structured and how they're designed. The earlier types of vena cava filter, the variation of which was Greenfield filter, is a permanent filter that was not designed to be removed. Um, our understanding of how vena cava filters evolve over time when they're left in has resulted in advancement and more design changes that now allows the vena cava filters to be removed. And the decision as to when it needs to be removed, how it needs to be removed, is individualized based on not only the patient but also the physician. Consideration should also be given in some patient population who've had repeated episodes of deep vein thrombosis to be placed on long-term anticoagulations. Indication for vena cava filter placement is whether they're patients appropriate for vena cava filters. These are designed to reduce the frequency of significant pulmonary embolism. And essentially, if you can think of an umbrella that the cover has been removed, so you have this shell of pliable metal probes that are compressible, and there's a video that we'll watch at the last part of this lecture as to how it's deployed, in fact. And when the umbrella is deployed in a vena cava filter in the direction of the flow, it's supposed to catch any blood clot that's large enough that could potentially result in symptoms of pulmonary embolism or be life-threatening to be caught in the filter. And over time, the body's own dissolving mechanism will then dissolve those blood clots to smaller portions that will filter into the lung. Indications could be recurrent DVTs and pulmonary embolism even when a patient is on anticoagulation therapy. Patients who cannot be on anticoagulation because of recent surgery, they have bleeding tendency, and more specifically in patients that have had intracranial bleed and or trauma patients. And this is a controversial point as to what type of trauma patient should be considered for vena cava filter placement. Earlier, some research had shown that patients with major pelvic surgeries in car accidents or something like that were candidate for vena cava filter placement. And now that teaching has sort of is being reevaluated. It is important to appreciate, and I get asked by patients that though why not place a filter in every patient? Because a filter does not prevent deep vein thrombosis. A filter prevents a clinically significant deep vein thrombosis from traveling to the lung. So the way to prevent actually a pulmonary embolism ideally would be to prevent a deep vein thrombosis from forming. And there is a multi probe approach to this. Hydration of the patient is critical, so patients need to be hydrated well priorly before surgery, during surgery, and after surgery. It is important that the patients are given for anticoagulation medication before surgery, during surgery, and after surgery. And what's of paramount importance is patient's mobility. It is critical that the patients are mobilized as soon as practical and possible after surgery. And so this means that we get our patients, weight loss surgical patients, out of bed within a few hours of surgery. In addition, pressure garments and foot pumps are placed. And as I said a little earlier, the approach to this is that we need to minimize the risk of deep vein thrombosis by addressing any and all the variables that reduce those risks. When we talk about vena cava filter placement, there are certain complications with vena cava filter placements. Some of them involve the location of how the vena cava filters are placed. Vena cava filters are placed just like a central line, or sort of a little more complicated than a PICC line. And these are done usually in an operating room or in a radiology suite, depending on the hospital and the physician who's putting it in. It's almost all of them done under local anesthesia. It's a relatively short procedure with um, some risk associated with it. Some of those risks include, again, as the slide shows, um, a localized issue that has to do with sort of a hematoma uh, at the site of the insertion. There may be also misplacement or acute blood clot formation around the vena cava filter that completely obstructs the entire vena cava, which is sort of a relatively major complication. Other complications of vena cava filter includes, as I said, vena cava filter thrombosis, occlusion or stenosis of the veins that drain the affected leg that had the clot in it. This probably has to do with the fact that vena cava filter, especially if it catches a clot, may reduce the flow rate of the vena cava. Filters may move in the direction of the flow, so you may place it in the proper place, which is usually above the renal veins, and they may move forward towards the heart. Filters fracture, and they may break and emboli the part of the blood clot. There are some anchors, very small, short anchors that are sharp, and they're designed to anchor themselves in the wall of the vena cava, and sometimes they've been known to penetrate organs that are attached to the vena cava. And one of the complications would be if there is a delay. If the plan was to remove the vena cava filter and for whatever reason it's not removed in a timely fashion, then that clearly increases some of the risk factors that are associated with clotting of the entire vena cava filter. How are vena cava filter patients managed after? Anticoagulation should be initiated to prevent extension of the deep vein thrombosis as soon as it's safe. Even in patients that had early contraindication for anticoagulation, and that's why the vena cava filter was placed, one should at every point in time consider whether they can go on anticoagulant, because the idea would be to anticoagulate the patient to therapeutic level to prevent their risk of getting the blood clot travel from the legs to the lung, and then at some point be able to remove the vena cava filters. The teaching right now, and this is a little different that was many years ago, is that ideally all the vena cava filters that are inserted now should be planned to be removed. And if vena cava filters are not removed, then the patient will require long-term monitoring of clinical status of the vena cava filter, and and it should not be considered that this is one of those things that should be placed in and be forgotten. Special consideration should be given when we're talking about vena cava filter, that in general there is very limited evidence supports the use of vena cava filter, and there is no evidence that vena cava filters prevent fatal pulmonary embolism. Again, the scientific evidence on this sort of goes both ways, and so our use of vena cava filter has significantly reduced based on the evidence that's coming out. The duration of the anticoagulation is generally not affected by the presence of the vena cava filter, so there's algorithms that the algorithms dictate how long a patient should be on anticoagulant, and the time frame for anticoagulation is not affected whether a patient has a vena cava filter placed or not. There's a few studies that dictate whether there's any utility of vena cava filter in children, and this is something that it's still being investigated in a lot more detail. What I'd like to do is review actual insertion of a vena cava filter, and this is to demonstrate how actually a vena cava filter works. So as the slide shows, you can see that there's a tube, a flexible tube that's inserted either through the groin or through the neck, depending on whether the filter is being deployed above, from the top or the bottom. And there's a catheter that pushes the filter out. The filter is essentially, and if you can think about it as an umbrella that's missing the cover, and that clear tube is represent the size of a vena cava. as this is sort of more or less spring-loaded environment, as the catheter uh, that contains the filter has a tube inside it. It pushes the filter out. The filter deploys and gets caught within the vena cava, and there are some of those prongs that have sharp edges to them, and they anchor themselves within the wall of the vena cava. And the way the static image shows now, where my hand is located is towards the leg. We're looking at it from the top end. We're just below the level of the heart, and the blood is flowing from distal to proximal, from behind the monitor or screen towards us. And any clot coming out is supposed to get caught within the lumen of the vena cava filter and prevent it from going to the lungs. As you can appreciate, that this is not going to catch every small clot, and the whole concept is that the small clots will probably get caught within the lungs, and they may be inconsequential. The key point of the vena cava filter is to prevent from large clot to go to the heart, to the lung, and eventually cause death. Thank you, and have a good day.